This week, the outbreak of Zika virus in Brazil prompted the World Health Organization to declare a global health emergency. The virus is spreading fast, and it's been linked to microcephaly, in which children are born with underdeveloped brains. Consultant virologist Tim Reggett is with us to talk a bit more about it. So, hello, Tim. What actually is Zika?
Well, Zika virus is a flavivirus, rather like dengue or chikungunya virus, and it's spread by mosquitoes.
And someone who contracts it, what signs do they display?
Well, they can have a rash or red eyes, muscle aches, that sort of thing, but only 1 in 5 people actually get any symptoms at all. So most people don't see anything at all, and it's not a severe illness unless you're pregnant, when of course there are issues.
Do we know why some people are more severely affected than others?
Do you mean in pregnancy or?
Well, you said only, say, 20% of people actually display any obvious manifestations. Why is that?
I'm not sure we know that yet. And I think one of the things about Zika virus is that we need a lot more research on it. There hasn't been a lot of work done on it yet. But obviously there's going to have to be a lot of epidemiology, a lot of detailed work on symptoms and impact, which I'm sure is going on as we speak.
It was first identified in the 1940s in Africa, in Uganda. So why is it only now that we're seeing big action?
Well, it's odd because you're right. It was first discovered in 1947, which was a very good year, the year I was born. And in the Zika forest in Uganda, it doesn't seem to have caused any noticeable problem in Africa. It wasn't until 2007 that it occurred in Micronesia, and then in 2013 in Polynesia, where there seems to have been spreading more. And it wasn't until it got into Brazil last year that there seems to have been any kind of concern about it, when they first started noticing the microcephaly in the babies.
And this is obviously the thing that people are most worried about, and why the WHO have said there's now grounds for saying there's a public health emergency emerging here, because if it was just the other symptoms, it would be so trivial we wouldn't worry about it. What is going on? Why are those babies getting affected like that? Do we have any idea?
Well, it's not been confirmed yet, of course, that the microcephaly is caused by the Zika virus, but it's a very high probability that it is. And so what's happening, we think, is that the virus gets into a pregnant mother, it crosses the placenta, it gets into the developing baby and causes a problem with the brain.
Do we know what fraction of infants are at risk and at what stage of pregnancy? Because some infections are much worse if the mother catches them at certain stages of pregnancy.
I'm not sure we know that yet. It's likely to be an early pregnancy, but we don't know. People haven't done the definitive studies yet. So at the moment we have to assume that any stage of pregnancy there could be a problem.
So what do people now need to do? Given we've got this observation, there seem to be rising cases of this, there seem to be lots of cases of Zika. What are the outstanding things for the WHO to really put the pressure on to achieve now?
Well, the problem is pregnant women. So clearly people are having to take precautions if they are pregnant and they're going to areas of the world where this virus is endemic. And remember, it's only spreading significantly in those areas of the world where there are certain mosquitoes. There aren't those mosquitoes in this country, so the idea of it spreading here is not going to happen, apart from the odd few sexual cases.
Well, tell us about that then, because it seems rather bizarre that you've got a disease that spreads by mosquitoes, but now you're saying it's a sexually transmitted infection.
Well, yes, we think that very rarely it can cause sexually transmitted disease. The virus has been found in semen. We believe, like in the American case recently, that it has been passed on from men to women through unprotected sex. So we have to be cautious, and that's why the guidelines came out that if men had been to a part of the world where the Zika virus was, they shouldn't have protected sex for 28 days and 6 months if they had any symptoms of the virus.
What about people giving blood?
Well, there have been recent restrictions in this country about people who have been to the endemic area to not give blood for a certain period of time.
And do we know whether that's adequate? Do people hang on to this virus for a long period of time like we're finding with Ebola, or do they seem to clear it quite quickly?
I don't think we know. We know that it can last for quite a while in semen, but we don't know for how long. And I think until the studies are done, we just have to take as many precautions as we can.
Are you worried?
Personally, I'm not worried. I mean, I think this is obviously a great concern, particularly in pregnant women. And clearly, the virus, could come to this country, but it's not going to spread in mosquitoes unless the virus mutates, which of course could always happen. But it's really pregnant women and taking precautions and being careful and looking at the relevant websites and really being very careful about it.
Tim, thank you very much. That's Dr. Tim Riggett, a consultant virologist at Adam Brooks Hospital.